Successful companies rely on healthy employees to maintain their success. Obesity and chronic health conditions are driving up insurance costs to the tune of $11 billion each year in lost productivity. Ivim Health provides a strategic blueprint to optimize employee health throughout tailored corporate wellness programs, providing cost-effective plans to increase ROI on health plan investments.
At Ivim Health, what we've recognized is that the current health insurance model in the United States doesn't really do a good job in terms of putting patients first. And so we've really tried to flip the healthcare system upside down, really be patient-centric and patient-focused. And the way that we do that is truly focusing on the patient-provider relationship. Every patient is connected with a board-certified physician with a team of nurse practitioners behind them. We have a team of patient experience specialists to really deliver customer support in every facet that the patient needs. IVIM stands for Individualized Virtual Integrative Medicine. We came together and created IVIM with the sole purpose of really putting patients first, not just to see a healthcare provider, but really to have a healthcare provider that would partner with them on their health and wellness journey. Obesity often is a precursor for many chronic disease conditions. You think of conditions like type 2 diabetes, cardiovascular risk factors that lead to things like stroke or heart attacks. What we try to do is manage obesity as the core component and the preventative factor for each and every individual patient, which allows us to prevent those chronic comorbid conditions.
My role at Ivim Health is as the medical director. I supervise the medical arm of our team, which encompasses our almost 100 physicians and nurse practitioners, as well as our nursing team and our functional health coaching team. My specialty is obesity medicine, so I take care of obesity as a disease process that it is and approach it from a lot of different angles to make sure that I provide great care for my patients and enable them to have lifelong results in their health outcomes. The main focus of integrative medicine is a holistic but yet personalized care plan for all patients.
What we've identified through the Kaiser Family Foundation actually is that approximately 40% of patients in the workforce are obese, and about 70% of patients in the United States are managing overweight conditions. A lot of insurance do cover medications for obesity. That being said, not a lot of insurance companies cover obesity medications related to GLP-1 therapy, which we see truly as the gold standard of weight management therapy. Less than 20% of large employers actually cover GLP-1 medications specifically for weight loss. And if you're a patient that's in a government-funded program, your chances of getting coverage are even less. What we've really focused on is increasing accessibility and affordability of medications, especially for those that can't afford it, and are working with employers to make those solutions available to their members as well.
I think the most important thing for employers to understand about obesity is that it's really a multifactorial chronic problem. So we have to think about it, a multi-pronged approach to treating it. It's not just about giving patients medications, it's about enabling them to make lifestyle changes for long-lasting results. I think forward-thinking employers can see that obesity is the root cause of a lot of other disease processes down the line. So if they're forward-thinking and want to be proactive and preventative, then they are going to absolutely understand the impact of obesity and want to treat it early on rather than waiting.
Every employer nowadays is looking to have the best gold standard set of benefits for their employees. And I think that's what Ivim at Work offers. We also have access to the medical therapies that we know are best for patients, medical therapies that are resulting in patients losing 15 to 20% of their overall weight. And through the Ivim at Work program, our patients on average are losing even more weight than just on medications alone. GLP-1 medications are FDA-approved medications for both diabetes as well as for weight loss. There's also some other indications that they've recently received approval for. Patients that are enrolled in the Ivim at Work program, we look at BMI parameters like a BMI greater than 30 or the definition of obesity as a potential candidate for therapy, as well as those with a BMI greater than or equal to 27 with a weight-related comorbidity. That can be things like cardiovascular disease risk factors, high cholesterol, high blood pressure. All patients that have those medical conditions would be eligible candidates for the Ivim at Work program.
As a small company, we often don't have the access to be able to control our benefit costs, and for a small company, we like to provide as much benefits as we can to our employees. It was an ideal way for us to join into the Ivim at Work program to offer this coverage, not just for our employees, but also for their family members who are on our program. This is one program that we are making sure that our employees know is available to them. The results for me on being on the program were really to drive down my overall A1C being a diabetic. So I've been quite successful in doing that. I think I started my A1C when I started was over 9, and my last blood test, it came in at 6. It's moved me down from diabetic to pre-diabetic. I'm looking for that to continue and maybe bring it down even below that in the future.
Half of Americans have shown interest in learning about GLP-1 medications. At least 13% have at one point in time tried GLP-1s, and currently 6% of all Americans are taking a GLP-1 medication for management of weight. Affordability of GLP-1 medications is a very big issue. It's usually somewhere between $900 and $1,400 a month. It is always important to focus on lifestyle interventions as well, and that is something that we do very well here at Ivim and through the Ivim at Work program.
I wanted to lose weight, wanted to feel healthier. Heard about Ivim from Pete, from Zavant, and decided to try it, and been thrilled with it. We had to do a video consultation. It was very thorough, asked a lot of really good questions, gave a medical history. I like that they have the video conferencing. Whenever you have a question, they're really prompt at getting back. They answer any questions I've had so far. They've been wonderful with that. Even about supplements, if they have suggestions, they've been great with that. I have been prescribed the tirzepatide. I've been on it for over a year, and my total weight loss now is about 75 pounds.
Ivim's care plans encompass not just medical management, but also all the other things that have to come into play to make obesity care work. We focus heavily on creating a personalized care plan that aims to treat the root causes for that individual patient's obesity. Before we even get into talking about medications, we're talking to patients about what has worked for them in the past and what hasn't. We drill down into the reasons why they're struggling with obesity in present day, and then we create an individualized care plan with medications and lifestyle changes that empower them to make the changes that they need to be successful going forward. And that support is not a one-time thing, it is ongoing. So patients can come in and see us, modify their care plan at any point in time to make sure that we are treating appropriately and on the right track. What might be working for you today in terms of an exercise regimen might be different next month.
So what employers are really looking for in terms of GLP-1 coverage is a solution that's going to help them control costs and reduce the overall cost burden of the medications, but also they want to make sure that the right employees are on the therapy and that they're utilizing the therapy appropriately. We do a great job in terms of screening patients to make sure that the appropriate patients that are going to utilize the medications appropriately are the ones that are being initiated on therapy. At the same time, employers are also facing increasing claims costs, and increasing principals. A lot of that has been attributed and related to the increased cost variables of GLP-1 medications. Ivim Health really offers a solution through the Ivim at Work program to lower those costs, and what that does for the employer is it makes them more competitive on their benefits programs. It really, in our minds, provides the gold standard of a health and wellness program to their employees, and allows them to not just have better employee acquisition, employee retention, but also increase the output of those employees. Less sick time, less time off due to medical illnesses or issues with their medical comorbidities, and also reduction in overall claims costs in the future with reduction in healthcare expenses related to obesity-related conditions.
To learn more about the innovative programs offered by Ivim Health, visit ivimhealth.com.